Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I'm joined today by members of my public safety and public health teams. I will provide an update on the district's response to COVID-19. First, I want to start by reminding DCPS families that the deadline to enroll in the Summer Bridge program is tomorrow at 6 p.m. The Summer Bridge program is for students entering the 3rd, 6th, and 9th grades, and it is designed to help students transition into a new grade or school. The program will take place at your child's school in accordance with DC health guidelines. Families may go to dcps.dc.gov or call 202-442-5885. And the dates for the Summer Bridge program are Monday, August 10th through Thursday, August 13th from 9 a.m. to 1 p.m. and Monday, August 17th through Thursday, August 20th, and again, 9 a.m. to 1 p.m. So please, again, register by tomorrow if your child is entering the 3rd, 6th, or 9th grades. We need to hear from you for our planning. I also want to provide a brief update on the district's numbers related to COVID. First, we announced 59 new cases, and we have been able also to announce that we have had 4 days where we report no loss of life related to COVID. You might remember that it was on March 20th that we reported the first DC resident who lost life to the virus, and this is the first time since then that we have gone 4 days with no lives lost. This morning, we also released the schedule of public testing sites for this week, which you can see here and which can be found at coronavirus.dc.gov. And once again, you don't need an appointment, but you can save yourself some time at the line by pre-registering at coronavirus.dc.gov/register. Starting tomorrow, we will have an additional antibody testing site, which will bring us to 3 antibody testing sites. The third and new location will be located at the Hillcrest Recreation Center. You need an appointment to be tested, and you may make an appointment by calling 855-363-0333. Dr. Nesbitt is going to talk more about this, but DC Health is in the process of working with the CDC to conduct a citywide serology survey. 850 households will receive a letter asking them to participate, and the results of the survey along with the results collected at our testing sites and at doctors' offices, will help DC Health better understand the spread of COVID through our community. Households participating in this survey will get free transportation to and from the testing site and a $25 gift card. So if you receive one of these letters, we urge you to participate so we can learn more about how COVID is affecting our community. The survey will end on August the 15th, at which time the district's antibody testing sites will also close. I do, however, want to remind residents that they will be able to access antibody testing through their healthcare providers. So please be on the lookout for that letter. And finally, on a lighter note, this summer, in partnership with Broccoli City, Events DC is hosting a pop-up drive-in movie series at RFK. And this week, they will be giving 300 tickets to DC's healthcare workers to show our appreciation for all that they have done. And we want to continue to remind everybody to keep our city safe and to protect each other, to be vigilant and focused on the things that have helped us blunt the curve, and we need to continue to be vigilant about them. Wearing a mask, social distancing, washing your hands frequently, staying at home if you're sick, and getting tested if you have symptoms or you have been exposed. So with that, we'll take your questions. Any questions? Yes, sir.
Just a question, the COVID numbers seem to be creeping up slowly. Any concern there? The new infections.
We are always concerned about our numbers and concerned about the spread in our community. So we remain concerned, and we remain focused on asking our residents and businesses to do all of the things that I just mentioned to help stop the spread of the virus. Yes.
On the 24th, a colleague of mine had reported that at some of the DC testing sites, that those waiting for tests, it was supposed to be a 3 to 5 day waiting period, turned into at least 7 days or more. Can you talk about how that has been resolved, if it's been resolved, and some of the numbers of tests, people going to get tested that you guys are seeing now?
Say the last part of your question.
How many people you're seeing going to get tested now?
Okay, I'm going to ask Chris Geldhart to come up. He's running operations for us at the Emergency Operations Center, and he can tell you about our experience with the average times for test results to come back.
Thank you, Madam Mayor. I think to answer your question, if I have it correctly, and you can correct me if I don't, the first thing is for testing in the 3 to 5 day, which we were at, or the 5 to 7 day, which we're at now. That primarily has to do with the amount of testing that's going on throughout the country, because we do use contract labs as well as our own lab to do the testing in the city. And with the amount of testing that's going on nationally, we're seeing those timeframes creep up a little. However, as we look at it today, we're just over 5 days to return on a test, which is longer than we'd like, but it's also within our 3 to 5 or 5 to 7 day range that we're at right now. We're doing almost 2,000 tests per week. 2,000 tests per day, which gets us almost to 10,000 tests per week. So that's what we're testing right now. We're testing both the public as well as all of our community areas and those folks that are in skilled nursing facilities and places like that throughout the city.
Director, can I follow up on that while you're up there?
Yes, sir.
Could you tell us, is LabCorp, so it's either Public Health Lab or LabCorp who are the two entities doing the testing for DC?
Those are our primary entities. We have other labs that do some, but not in the volumes that we do between those two, yes.
So can you tell us what DC is paying, what the cost associated with doing these, the high number of testing outside of DC that private contractors are doing for us?
Sure, it's $90 a test.
And so how does that extract, how many tests have they processed? How much?
So what you just gave the numbers, Mark, so we're doing almost 2,000 tests a day. Of that, probably in the neighborhood of 1,400 to 1,500 of those are going outside the district.
Is that money DC will be reimbursed?
So there's multiple mechanisms to do that. The CDC has money that they've given for testing. FEMA covers certain parts of our expenses for testing. So the costs all around the testing things are all covered under some kind of reimbursement, may not be 100%.
And then just to close the circle on this, what does it cost the public health lab to do that test? If it cost us $90 to have LabCorp do it, what does it cost to do it in-house?
So the public health lab for the reagents cost is about $50 per test. And then you have to add in all the personnel costs and everything like that, like you do for the other tests.
Thank you.
Other questions? Yes.
So it looks like every time we get to about 40 cases in the community spread data, we have another peak. Do you have a number, maybe this is a question for Dr. Nesbitt, do you have a number that you're aiming for that we need to see, I don't know, 10 cases a day, 20 cases a day in order to have sustained community spread decline?
No, there is no specific number.
And can I ask also about this antibody testing household survey? Are these households selected at random, or are you trying to get a representative sample somehow?
Yes, the addresses are selected at random so we can have a representative sample, similar to the behavioral risk factor surveillance system that randomly selects households using a combination of landlines and cell phone numbers to help us randomly sample the population across ages and races and ethnicities. We're doing a similar random sampling of households so that we may get a good sampling of the district's population across age groups, races and ethnicities, and hopefully occupations, so that the risk of exposure can be randomized across the jurisdiction. And it is households, not individuals.
Thank you.
Dr. Nesbitt, there are some other jurisdictions when it comes to contact tracing where they're hearing from residents who say they're not participating out of privacy concerns. Are you concerned that any folks with this survey might be trying to do the same thing?
I am not.
Yes, sir.
Can Dr. Nesbitt or the mayor, or both, could you tell us what we're to make of? It's certainly good news that we see for the first time 4 days of no deaths reported, but it seems that in the past week or so, and I guess now that we're into phase 2, we have seen the average number of new cases has ticked up a little bit. So I'm wondering if you can kind of square that circle for us, those two.
Sure. I'll just remind you of the past discussions that we've had about our leading and lagging indicators. And so you tend to see an increase in incidence or the number of new cases, followed by an increase in hospitalizations, followed by an increase in deaths. So while we are very happy to see no loss of life in the district whenever that occurs, we always are aware that you first see an increase in cases, followed by an increase in hospitalizations, followed by an increase in deaths. And each one of those indicators tend to lag by 2 weeks.
So, Mark, I think you asked the question that was asked earlier, that we have some numbers in the 50s, we saw some numbers in the 30s. What does that mean? And I don't know that we can say that it's triggering anything. We're following the metrics that we outline, but we also know that the virus is not gone. It continues to circulate in our city, and I don't know that we can say more than that, but the virus is not gone, and we know that people are, in some cases, increasing their level of activity in their contacts. So in addition to wearing a mask, social distancing, washing your hands, staying home when sick, we continue to ask people to be judicious about their activities as well. Yes, sir.
I'm sure you saw the news about the name of the football team. You have spoken of your desire to have the team playing in.
Anything else on topic?
Oh, sorry, I thought we were.
Okay, yes.
I'm happy to wait.
Correct me if I'm wrong, it's my understanding that there's been guidance for how public schools can reopen, but DCPS has not officially released anything yet. Is there any more information on what parents might expect to see, more concrete plans for possible return?
We expect to be able to talk more about DCPS this Thursday. And I already mentioned some other DCPS guidance in that we want people to sign up for their 3rd, 6th, and 9th graders if they want them to participate in the 2-week bridge program that starts on August 10th. Yes, sir.
Could I follow up on just kind of along the schools, but ask about pools, swimming pools? I believe the council was told in a call that may be happening this week or next week. Do you have a date on when?
We actually said early on, Mark, when we entered phase 2, that we would be looking to this week to open public pools in a limited way. We're going to hold off on that decision until the end of the month. So we would expect in the end of July to tell you a little bit more about that. Yes, Sam. Is that Sam back there?
Yes, ma'am.
Okay, you're sitting in a different place.
Plug in back here. Last week we looked at the recreation centers, and we were told that starting, I guess, Monday, that about 3,000 kids were going to be coming into the recs. Is that still on schedule?
Do you have that, Chris? I think that the plan is that we had 10 very small number of, and I don't have on the top right now when they're going to start, but we were aiming for a start around this time. And they're very small group rec activities in addition to rec at home programs starting, where we have supplied several thousand families with a recreation in a box so that they have activities that they can do at home with their families. And then we have another group of kids who will participate in person.
Yeah, I understand that, but I'm just saying, you were saying that the swimming pool would be moved back.
That's correct.
I'm wondering if, in fact, because my understanding is that 3,000 kids are being do in-person recreation starting on Monday.
Right.
That, in fact, is going to be still on schedule.
Yes, that is.
All right.
Yes.
Football team.
Yes.
You had mentioned in the past your desire to have them playing in the district.
Yes.
Can you speak a little bit about what the name change implies for you and what other obstacles would remain in your?
Well, I would say yes, we want to change the name and change the location. You've heard me say that a number of times, that the Washington football team should be playing in Washington. And to be honest with you, we haven't been focused on anything related to deal points in some months. But there are a lot of different components, including getting control of the land. And what would work for those parcels for the District of Columbia. The Events DC has for a number of years now presented and vetted plans that would include an NFL stadium and that would not. Priorities for the district, of course, would continue to be how we could have a mix of uses that highlighted our beautiful river, that invested in our need for housing and park space, and entertainment options, which is the current designated use of the land. Yes, Sam.
But it would still be we're in the RFK area, that is the Reservation 13, it would still be in that area.
It will be at that site. That's the only site that the district is interested in. Okay. Yes.
Can I ask about Black Lives Matter Plaza?
Sure.
And the vendors that have been there. I believe they were told that maybe today is the day they need to get out. And what does that mean for them? Are they going to be allowed to come back? What's going to happen there?
Well, we have worked with the bids in the area to try to find locations for authorized vending. Currently, folks have been there, and the vending locations are not authorized.
So do they have to get out today?
They would, yes.
And if you're going to move them out if they're not?
I don't expect that we're going to have that problem.
Okay. And then could we ask Chief Newsham? I see Chief Newsham is
Sure.
here, I'm sure.
Yes, what's your question?
Well, just an update on just
Sure.
the violence we experienced this
Chief.
weekend and now being at 101 murders. Thank you.
I'm Pete Newsham. I'm the Chief of Police for the Metropolitan Police Department. Thank you, Mayor Bowser. We had 7 homicides over the weekend. As you know, we had 4 on Friday. 2 on Saturday, and then 1 that happened yesterday where the victim in that case actually passed away this morning, early this morning. 4 of the homicides that we had over the weekend actually occurred inside of residences or inside, in one case, inside of a hotel. You know, I think it's disturbing to all of us to be over 100 homicides at this point in the year.
Can you give us any specifics on any of those cases? What happened in the hotel or in the homes? Or do you have suspects?
I can run through them. It's not going to be quick, but I can tell you we had a shooting around 5:20 p.m. in the 5th District at the 700 block of 21st Street. An adult female, 45-year-old Tamika Jones of Northeast DC was killed. In that particular case, it looked like a drive-by shooting. We also have evidence that somebody fired back at the vehicle. We have recovered the vehicle. We recovered it in Ward 7 that was involved. That should give us some information as to who was involved. At about almost 6 p.m. that same evening in the 4900 block of North Capitol Street, there were 3 males that were in the parking lot. A suspect approached with a gun. A struggle ensued over the gun, and 45-year-old Jose Cuck of Northwest DC was shot and killed. We are up there today looking for video in that case. If we have valuable video, we'll obviously share it with you. Then around 6:20 p.m., inside of a hotel in the 1100 block of New Hampshire Avenue, we got a call for an unconscious person. When we arrived on the scene, we found a 40-year-old male, William Charles Dismuke. We do not have an address for Mr. Dismuke at this point. He was inside of the hotel room. There was no forced entry in that case, and he was suffering from a gunshot wound to the neck. He was later pronounced. And then we had in the 2200 block of Newton Street, we had the decedent in this case is 19-year-old Everett Harris of Southeast DC. He was traveling in a stolen vehicle. Another vehicle approached, opened fire on the vehicle. Unfortunately, Everett was shot and killed. There were 3 other subjects, at least 3 other subjects in that vehicle with him who fled on foot. So if those folks are out there, we'd like to speak to them. And in that case, we're looking for a red Ford Taurus, a 4-door Ford Taurus, occupied by 4 individuals. So if anybody has any information, that would be helpful to us. And then on Sunday, at about a little after 4 a.m., 5D responded to a home in the 800 block of 19th Street. Inside the home, they found an adult female, 28-year-old Shanika Williams of Northeast DC. She was suffering from a gunshot wound. We believe that case is domestic in nature. We've made significant progress in that case. About a half hour later, at 4:30 a.m. on Sunday in the 3900 block of S Street inside of a home, we found 58-year-old Paul Lewis of Southeast DC suffering from blunt force trauma. There was no forced entry to that home. He was taken to a local hospital where he was pronounced dead. And then lastly, on July 12th, in the 3300 block of 15th Street Southeast, we had a shooting that occurred inside of an apartment. 34-year-old Gary Swinson of Southeast DC was pronounced as a result of that shooting. And we don't have a lot of detail right now on that case with regards to suspects. That's our most recent. We have our detectives working on that. So, yes.
This isn't the first time we're here talking with you about an increase in violence in the city. What do you make, obviously we have a pandemic going on, but what do you make of what's going on and how is the police department trying to address some of these issues? And also, do you have any words with regard to DC Union and Councilman McDuffie kind of going back and forth on Twitter about these homicides?
Yeah, I saw a little bit of that back and forth. I didn't pay too close attention to it, but I will say this. I think we've talked about the increase in gun violence in our city for the last 3 years. It's really kind of troubling because if you look at violent crime in our city, every other category of violent crime, we've had significant progress in reducing those numbers across the city. And it's the gun violence that's the challenge I think that we all need to tackle. I have my opinion as to how we tackle that, and I know others have theirs. And I see repeat violent gun offenders being released back into our community, using guns again, and then people end up dying as a result, unnecessarily and tragically in a lot of circumstances, as we saw on the 4th of July when we had an 11-year-old boy that was murdered.
Mayor President Julie? Yes. Mayor Bowser or Chief Newsom, have either of you been communicating directly with council members trying to discuss whether before their second vote on the budget they can increase some of that funding for the police budget?
We haven't yet specifically, but we will.
Mayor,
Yes.
on emergency police reform legislation, I understand that has been transmitted to your office. Have you had a chance to review it, and if so, what are your plans as far as signing that?
It was transferred to us, I think, on Thursday and reviewed. I think the legal sufficiency is done, and so now I'll review it this week. Yes, sir.
Yes, I'd like to ask the chief about one of the suspects, I guess, in the Devon McNeil case. Christian, you've already arrested him, right? You all have already arrested Christian,
Yes.
correct? So some of our people were asking about his criminal background, saying that they could only find one arrest. How extensive was his background? I thought you were telling us they all basically had pretty extensive criminal
He did have an extensive arrest record. He had a felony conviction, and in the spring of this year, he was charged with felon in possession of a firearm. So he had a felony conviction, subsequently was arrested for carrying a gun in our community, was released back into the community, and now he's being held responsible for that killing of Davon McNeil.
So Chief, you said all four, as I recall, all four of the people who were sought or arrested in that case had previous gun charges involving them.
I know that at least 3 of the 4 that we have warrants for had prior gun charges. And you know, if you look back at our homicides in 2018 and 2019, it runs about 50% of the people that we arrest for homicide in this city have a prior gun charge.
Do you have any suggestions about what should happen in cases?
I think I've said it over and over again. I think that people that are involved in gun violence or who will pick up an illegal firearm in our community have to be held accountable. There has to be consequences that change behavior.
Such as what, holding them longer in jail, or what?
Whatever those consequences mean, that we need to change behavior. And right now, it doesn't appear what we're doing is changing behavior. So I don't know what I don't like the mayor will say we don't have a magic wand to stop this, but we definitely need to think about what we're doing right now because it's not working.
And Chief, as you look around the country, it seems that this is not just common to DC. It seems to be going on in a number of other places.
Yeah, I mean, you can see what they're reporting in the media. They're taking other big cities. I don't know if that is the collective sense of all the cities. We will have a better tally of what all the major cities have closer to the end of the year. So I don't know how true it is that it's happening in every major city. Of course, you see a rise in crime in New York. I think Chicago's having some difficulty, Philly and Baltimore as well. So yeah, we have to be concerned about gun violence.
So I'm wondering, is there something that set this off? Do you have any sense of that? Is it popping up in so many places?
I want to talk just specifically about here in Washington, D.C. and what I see. And what I see is young men that are inclined to use firearms, that are being arrested with firearms and are being released back into our community. And I think that that's a recipe. If you look at recidivism rates for gun offenders, they're pretty high. So I think we need to think about what we're doing there.
Yes. Mayor Bowser, could you also weigh in on that? And is there anything that your office could do to address some of this?
I don't have more to say right now than what the chief has already said. We tend to see in the districts a small group of people who have been violent, who are violent, and who have weapons, who cause most of the violent activity. And unfortunately, the police see them time and time again. We have invested in this city in violence interruption. And part of our program that is run out of Dale's office is for pathways that acknowledge that there are a small group of people who, if we can help them get on the right path, they may not only change their own trajectory, but they may also be leaders in the community and can change the trajectories of their families and other people around them. So we continue to think that in helping to identify who those people are, get them in the Pathways program, that we can continue to help. But that is no substitute for people who have demonstrated that they will kill other people for being off the street. Yes.
I just wondered if we could hear from Mr. McFadden.
Sure.
What he's doing, whether he thinks it's working, and to what degree he may be working with the violent interrupters of the Attorney General.
Thank you, Mayor. So what we're doing, unfortunately, COVID has slowed us down a little bit, but we are ramping up as far as touching our 21 focused primary communities. And so right now, even on the 4th of July, there's various things that's taking place, whether it be retreats or young men groups or healing circles or virtual employment opportunities for the very individuals that the mayor is talking about. So we stay committed to this work. Of course, it takes time. What we're looking at through this public health approach is looking at the stages of readiness, how many times it takes for us to engage an individual before they make the choice and decision to go through a Pathways program or even accept help. This is the most resistant group of individuals to help, to change. Change is difficult for all of us, but we have to hold people accountable for things that they do in the community. And we're here to provide a very comprehensive a myriad of supports and services, from mental health services to education to employment training, the way that our janitor to the security guard at the front door Pathways. And so money has definitely been invested to taking the Pathways programs to 4 cohorts. So we want to touch as many of these individuals as possible, and we're going to stand fast on moving this work forward and work with as many of these individuals as possible. Yes, we do. Yes, we do. We have conversations. We have communities that's at odds. We have triage meetings. We sit down and plan who we need to talk to, who's willing to come to the table. Sometimes individuals, there's a situation that we're dealing with right now. Individuals just not willing to come to the table to squash, mediate the situation. And so sometimes we have to hold out, but we continue going back until that individual decides to make change.
And Mr. McFadden, you all are working with these individuals now. What sense do you have as to what's going on here? Why are we having homicide rates?
Well, I think there's a lot of pieces. There's not, when you look scientifically, it's not one thing. I think COVID has, we're in very challenging times, and uncertainties and things of that nature play a role. Access to firearms and just the social norms, the culture. And so we're working to provide opportunities and pathways so that individuals can live their life, change their community, change the trajectory of their families. It's very tedious work, but it's also rewarding, but it takes time. For our violence interrupters, that program on the 30th of last month hit 2 years. And COVID has slowed us down a little bit. And so we're looking to continue to push, to work with the individuals who want to change, and the individuals who will accept their opportunities for employment, mental health, things of that nature. So we're going to continue to push.
How do you measure success, especially with the violence interrupted program? I know, some of the folks in the community are saying you don't hear about those cases where someone says, okay, I'm going to put down.
Yeah. So a lot of this work takes place behind closed doors, in the living rooms or on outings, or taking individual to the DMV in Georgetown so that they don't run into any individuals that they're at odds with. There's a lot of thinking and planning that goes into, you don't just take an individual off the street, you have to plan and keep everyone safe. And so, of course, the metrics that we look at mostly is homicide reductions and violence reduction, but also we look at, did we successfully connect that family to the supports and services that they need? Every individual that comes through that office do an individual development plan or work with a case manager to look at the risk factors. And the goal is to reduce those risk factors and have them complete the services that we connect them to.
Thank you, everybody. Thank you.
Go ahead. Thank you.